you all so much for coming out today and joining us for this Talk Justice Tuesday. Woohoo! I'm Roberta Myers Douglas, and I'm with an organization called Legal Action Center, and we're a nonprofit law and policy organization that does advocacy and education across the country, fighting for the rights of people with criminal histories, past drug and alcohol histories, and also HIV/AIDS. Something that's been important to us since the beginning of our organization. We've been around for almost 50 years now. Is what is happening to people at the intersections of the health system and the justice system. And over the last couple of years, we've really began to focus more on looking at those intersections and developing advocacy models that connect the two and really looks at a lot of the gaps that exist within those systems that are failing people. So I'm going to go to read, so make sure I don't forget anything, and I want to make sure I recognize our partners. So again, thank you for participating in this Talk Justice Tuesday series, Healthcare and the Criminal Justice System, Increasing Opportunities for Diversion through Treatment and Services. And so that's really what we are focusing on. A lot of people are very much concerned about the numbers of people that we have going into the legal system, and communities across the country are now needing to and recognizing that they need to figure out a way how do we keep people out and help people much earlier in their times of distress, and being thoughtful and responsive to the healthcare needs that may often be driving certain behaviors that are going on. These events, so this is a series of one of 8 Talk Justice Tuesdays that the partnership has been holding. The Georgia Justice Reform Partnership is a collective of over 50 organizations and individuals that are interested in supporting criminal justice reform work in Georgia. And we just had our Justice Day 2020, was it a week ago? I'm losing track of time. I think it was February 27th, where we asked everyone who cares about what's going on in the state of Georgia and want to participate in some of the reform activities that are going on and meet with the legislators to talk about what they have interest in seeing, and also talking about what's currently pending and how they want our legislators to move forward, to come here, come together as a unified voice and participate in a meaningful way. Our goal as a partnership is to identify other ways throughout the year that we can come together. And so the Talk Justice Tuesday series just became another way that we can come together and kind of drill down on specific issues that are related to justice reform. So again, today is focused on healthcare. Next week will be the session talking about what's happening within this legislative session, kind of where things are, where they're ending up, and you can learn more about where different pieces of legislation landed. But we'll get there and touch on a little bit of that later. Today's event is being hosted by the JRP member organization, Southern Center for Human Rights, Motherhood Behind Bars, Fulton County Pre-Arrest Diversion Initiative, and my organization, the Legal Action Center. The National Incarceration Association is coming out too and plays a part also. There are too many people in the criminal legal system in Georgia who could be better served with effective and affordable community-based treatment and services. We will discuss ways to increase access to preventive care and treatment for the conditions that most often coincide with criminal legal system involvement, such as substance use disorders and mental illness, HIV/AIDS, Hepatitis C, etc. Prioritizing diverting people with chronic health needs from the legal system at all phases of the criminal legal process is really what we're trying to get to. So that includes pre-arrest, at pre-trial, pre-adjudication, at the time of community reentry, when people are on parole or other post-release supervision. And we also want to ensure that law enforcement obtains the training and support needed to ensure individuals can be diverted to care and treatment. But before we jump in, I'd like to lift up the names of some women whose lives were profiled in an Atlanta Journal-Constitution article back in December. And some people have passed in the prison system who have had chronic illnesses. And I think that there's some things that we can do. Often people fault only the agency that holds people in incarceration, but I believe that there's a lot more, and there are a lot more of us involved in what happens to people long before they get to the point of being in that kind of health distress. So we want to analyze that. This is not about pointing fingers at any one agency. How can we support and fight for the kind of services that we want to see in the community, and also make sure agencies that are charged with dealing with our people, that they have the resources and the people in place who can do it effectively. So the names I wanted to lift up who were identified in that article: Cassandra Gilbert, Susan Whiteman, Rosalind Pettiford, Stephanie Widener, Melinda Holden, Mary Ann Reinhardt, Marla Nichols, and Barbara Ann Orzak. And these are the ones who are named, and there are so many who are unnamed, who are suffering in cages and suffering and trying to manage and survive various conditions that we need to try to work to make sure people get the care that they need. Again, our goal today is to encourage you to get involved in efforts that are centered around diversion to care. That's physical health and mental health and addiction services. Before arrest or after arrest, we will talk about some of the ways that is happening in Georgia. I'm going to ask my colleague Victoria Palacio to come up, and she's going to tell you in a few minutes about our No Health Equals No Justice campaign. Hopefully everybody got their button. Go get your button, go get your button. And then after Victoria, and we're going to move the program around, we graciously, Rep. Kennard came in, and he's so dedicated, y'all just don't know. Or maybe you do know. He really supports a lot of the efforts of the Justice Reform Partnership and shows up. I don't know a time that you haven't shown up, and really appreciate that you do take the time out of your schedule to come in. And it has offered to speak to you all, and unfortunately has to run over to the chamber. This is a funny and hard week for our legislators. Crossovers this week, so a lot going on. But he graciously came in to give a few words. So Victoria, you go, and then Breakfast, you would speak for a few minutes.
Thank you, Tony, and thank you all for giving me the opportunity to share about our No Health Equals No Justice campaign. It's a pleasure to be here today. As Tony mentioned, the Legal Action Center has brought forth the No Health Equals No Justice campaign, and the premise of the campaign is really that people shouldn't be incarcerated for a health condition, such as a mental health condition or a substance use disorder, and that at every point in interaction with the criminal justice system, there should actually be a point for people to be diverted to treatment and health care instead of punishment. And so I just want to outline a little bit about the campaign. The campaign is actually a vision of Tony and a few of our colleagues in our other offices, and it encompasses Legal Action Center's missions. As Tony mentioned, Legal Action Center, we advocate on behalf of people who are formerly incarcerated, have a substance use disorder, mental health disorder, have HIV or AIDS. And so this campaign really encompasses that mission while focusing on the need for a cross-sector approach that recognizes the relationship between systemic racism, mass incarceration, and inadequate community health care systems in order to achieve racial equity in the healthcare and criminal justice reform. Our campaign is about 2 years old now, and it's a multi-state campaign. Of course, we're here in Georgia. We do work in Georgia. We are also active in New York and DC, where our other offices are, as well as in Ohio, Tennessee, and Alabama. And we just really believe that in order to address pervasive biases and institutional racism and discrimination, we have to tackle the root causes of those problems, which are racial and economic discrimination, rather than the symptoms of them, which we see all the time, which are poor health outcomes, mass incarceration, unemployment, and underemployment. And so, just the goals of our campaign, I mentioned we have health goals and goals around reentry. Pertaining to health, some of the things that we advocate for are access to preventive health care, access to treatment for conditions that coincide with the criminal justice system, such as mental health conditions or substance use disorder or Hep C, HIV and AIDS, diversion to treatment at all phases of the criminal justice system, and training for police on how to divert people away from the criminal justice system. And on the reentry side, we focus on linkage to care so that people have access to health care as soon as possible upon release, engagement with health insurance, and protections of civil rights to prevent discrimination in employment, housing, education, and other points in which people are discriminated against due to a record. So, in conclusion, thank you all for being here. And the No Health Equals No Justice campaign, we're really about the work, and what we're presenting about today, it all goes hand in hand with our issues. People shouldn't be incarcerated unfairly, and that people need access to treatment and services in order to be successful once they are released. So, thank you all.
Thank you.
Thank you for being here this morning. It's always encouraging to see this many folks show up for this issue. I'm Greg Kennard. I'm the representative for District 102, representing Gwinnett County. So I represent Lawrenceville, Swanee, a little bit of Sugar Hill. The United States is actually one of the worst places on earth to be if you struggle with a mental illness. And within the United States, the state of Georgia is one of the worst states to be in if you struggle. We are number 47 in terms of access for adults. Some watchdogs say we're number 50, so we're almost dead last in terms of mental health treatment and access to it. NAMI, the National Alliance on Mental Illness, tells us that most people who struggle with substance abuse and addiction, there's an underlying mental health diagnosis that's untreated, which leads to the addiction or self-medicating. So instead of dealing with this issue as it really is, which is a health issue, the last 40 years we have dealt with it as a criminal issue. With the policies of the war on drugs, we have effectively criminalized mental health. The largest mental health service provider in our state is Georgia State Prisons. Troops. More than Georgia Regional, more than the psych wards at our hospitals, more than Viewpoint Health, which is up in Gwinnett County. Georgia State Prison is the largest mental health service provider. I came to this space by way of the work I do professionally. I'm an ordained minister. I run a nonprofit called Inspire Outreach. We have a program to help homeless individuals get them back on their feet. And we have residents, we have job training, counseling, mental health services, life skills training, financial literacy, just a holistic approach to try to get someone back on their feet. But over 15 years of doing this and seeing thousands of people, you see kind of the patterns. You see kind of things just keep repeating themselves. A typical client for Inspire would be one who's the educational system failed them, they dropped out of school, they have a mental health diagnosis, and then they have a subsequent addiction issue, and they have a felony background. So there's connective tissue between all of those things, and most often there are a person of color. 2/3 of our folks are men and women of color. So I'm so glad you're here because I'm optimistic that we can change these policies and change the legislation around them. That's why I'm here. Ran for office on these issues just about exclusively. I'm a freshman legislator. This is my second session. But I'm optimistic that we're going to move in the right directions. Accountability courts are actually a very good move in the right direction. My program works very strongly with accountability courts around the metro area, mental health court, drug court, veterans court, and that is a beautiful alternative. And what needs to sink in is there's a better economical system. For every dollar that we spend in accountability courts, we save $7 in corrections. So we need to expand that. That's why it was unacceptable for me and many of my colleagues that there was budget cuts that cut accountability court, that cut public defense, that cut mental health. We have fought hard to get much of that money back, but we still haven't gone far enough. But I just want to encourage you to keep fighting the good fight. It's worth fighting for. Don't grow weary in well-doing. Let's all pull on the same end of the rope and see some changes. Does anybody have any questions on here? Yes,
I looked up your website. Is it okay if we connect to you through there?
absolutely.
I work at Leardale State Prison in Gainesville, so it would be great to have a resource of you.
Definitely. Yeah, we're a reentry option for many of our correctional facilities. I'm in the process of visiting all of our state prisons. I've got about half the list knocked out. There's a lot of them. Peppered through all the state. Got about half of them knocked out. But we have more prisons and jails than we have colleges and universities in Georgia. Wow. Maybe there's a connection. About 70% of our prison population were school dropouts. That's why I've got to focus on literacy issues.
Yes.
You know, if you're not reading on third grade level by third grade, the chances of you being incarcerated are very high. That's why I've created a bill that expands pre-K and kindergarten throughout the state. We're already spending money on literacy issues, but we're spending it in corrections. That's where how we're trying to solve it. So if we, over a 5-year plan, just moved corrections budget to pre-K, we'd reduce our need for prisons in 5 years. Yes, ma'am, you had a question, I'm sorry.
My name is Laura Nieto, and I have my only son in prison. He went to Georgia Tech. He is a very bright person, but he suffers from schizophrenia, mentally ill. He went in and out of facilities, psychiatric facilities. They couldn't do much about him, and he ended up in prison finally. I am here in Georgia in Phillips.
Phillips.
Phillips State Prison. I am a educator, and I understand what you're saying very well because I have taught all my life, kids, they actually were not ready to graduate from high school, and yet we had to let them go, and that is the main problem. My son actually is helping us to meet the GED to graduate, to get the GED. The problem that I see is the facility, supposed to be the best facility at Phillips State Prison. And he has a cellmate who actually is a veteran, and he suffers from, he has some disability, physical disability, his back. He cannot walk very well, so he cannot go to chow. Some people have to bring him food, but sometimes the food never gets there, so he doesn't get to eat. It is pretty bad what is going on there, They only have Friday, Saturday, and Sunday, only have 2 meals, 6 a.m. and 3 p.m. And if you don't have a family member who actually can send money to have an account there, they go hungry.
Right.
That is the worst thing that it bothers me. I am a Department of Corrections volunteer. I have to become just to be able to see a little bit more, what is going on in other prisons. I cannot go inside in that one, but I can go to other.
Yeah, they just hike the prices on that commissary situation too.
Exactly, and that is in the, it is pretty bad how much money they can save. I can see that very well in all kind of nutrition. And you know, all those vending machines, the small bottle is $1.75. I mean, it is really an abuse of these companies they have. And then, and also, many people there, they're not having medication.
No.
So it is pretty bad. It just happened not long ago. The water was coming through the toilet in the cell, and they were not fixing something that it didn't need to take too long to fix it. And I had to write letters and letters, and I was going to go all the way to the top. Finally, they, in this during Christmas and New Year's, of course, and they let it go like that. It's pretty difficult. And
In most of our facilities, there's no heat and air, so in these hot months and these cold months, it exacerbates the mental health
Yes.
condition.
My son was saying there is a fan there. They can actually probably, it's a motor or something, it's a stock they need to just fix. It's not that much where it can, you know. And I said, look, I can donate if you want me to, but please look at that. He said, oh, no, we will do it. But then when? So it needs some accountability and what, I'm not sure how or where, but I just would like to bring these problems that are going on in there, but especially for the disabled. My son is mentally ill, but he has me at least to put the money there and I go hungry.
Right.
And, you know, and the other thing is the legal system, the lawyers. I was charged $65,000 so he can get convinced to get a plea. And then I got another lawyer, $65,000 for the heaviest. I got all the money out of my equity, of my home equity. And nothing has been done. He is mentally ill. He suffers from schizophrenia. And still, nothing can be done. So I just want to bring it to you, the real thing, because I go inside, I can see it. You know, it's a really terrible place to even get in when you have to check everything. And then they have to actually get all the clothes off to be checked in and out of the prison.
And your situation is multiplied thousands of times.
Exactly.
Fortunately, your son has you. Many of our other friends in the system do not have an advocate like you.
Yeah, but like this veteran person who is there, you know, sometimes he ends up hungry, and they live, I mean, what it really bothers me is this. They actually are punished for stealing food from somebody else. Well, if you are hungry, you're going to need to steal.
Sure.
I mean, what else can you do if you see somebody else has, well, you're going to
And
go.
oftentimes they'll put the mentally ill patient in solitary confinement, which makes it compounds it even further.
So just, I think on that note, and Ms. Nieto and I met at Justice Day, and we started talking about some of these situations. And one of the things that I was thinking about, possibly compassionate release legislation, and I don't know if some had been introduced before. I know we have a medical leave process, like you have to be on your deathbed in order to get released, but finding some way to, because other states have that, especially for severely disabled or elderly people who are incarcerated, and thinking about ways that we can support individuals who might not have any family who can fight for them, and setting up processes that will allow for some review to happen in those situations. So I think that's one of the things we want to talk about, different ideas. You didn't know, I invited Dr. Jackson to come from the Department of Corrections. She has oversight over mental health services statewide for the system, to talk about what's going on there, what they're trying to do, and then, you know, with some suggestions on what we could do to help with improving and increasing services within the system. But hopefully before anybody has to ever step foot in a prison cell. So I'm partners, I'm moving the agenda around, sorry. But I think it's important for Dr. Jackson to kind of talk about what I asked her. If you want to come, you can just stand up there. We've been keeping it real informal.
Good morning, everybody. It is good to be able to be here, and part of my focus today is to just talk about how we are quite aware that there are people who are incarcerated who should not be. And there have been times to start, I guess from the beginning. I started with the department in '98 as the clinical director of Metro State Prison, which is for women. And once they closed, I went to Learendale State Prison, and about 5 years ago, I went into central office as the statewide mental health director. But while I was in the prisons, it was often that I would evaluate someone and wonder how in the world did they get in prison in the first place. And what happens is that they come into the prison, they have an evaluation not only for education or medical, but also mental health needs. And so we try to stratify them so that we can work on those that are moderately to severely mentally ill. Now, luckily, that's about 4% of the population. About 20% of the prison population is mental health. The majority of them are considered outpatient. But in many cases, their crime was due to self-medicating either from drugs or alcohol. They committed a crime in order to continue their substance use and ended up in prison. And it is great to have the advocacy courts and the accountability courts, I should say, both drug and mental health courts, to hopefully divert those who really need treatment, not incarceration. We try to do what we can to treat those that are incarcerated, but it would be so much better if there was like mandatory treatment instead of mandatory sentences. You know, if they could be treated first and then have to be accountable for staying clean, being able to change. Because there are many people who, once they get into prison, once they are medicated, they do just fine, and they're not a problem at all. And which proves that if they had the treatment ahead of time, they would have been just fine, and they never would have needed to go into prison in the first place. And so it would be really good if ahead of time that can happen. I had many case examples, but one in particular, she had never been to prison at all before, and she was absolutely uncontrollable from a behavioral perspective. And once she was medicated, her diagnosis was bipolar disorder. Once she was medicated, she was just fine. She gained some weight on the medication, and she was like, you know what, I don't care. I have never felt like this before. I've never been treated, and, you know, did not know that she could behave the way she was behaving with medication. Well, she eventually got out, and we would have bet money that we never would have seen her again. And lo and behold, she came back in and said she could not afford to stay on the medication once she got out. And that was just heartbreaking. So of course, because we knew her and we remembered her and we remembered she was on Zyprexa, we quickly got her back on. She quickly cleared up. And I looked just before coming here, and she is out. She is on probation, but hopefully she is able to continue on that medication, because there were many medications that were tried, because it is a trial and error type of process. We found the one that worked for her. And so hopefully she is in a situation in which she has the means to continue. And it really would take advocacy for her to be able to have that medication. So she could have avoided prison altogether if she had been treated first. If they had just recognized that that behavior, something had to have been going on, and if they had just tried to treat her. And then on the outside, once being released from prison, if she had just continued to have support so that she could continue on her medication, she would not have ended up back in prison, but it was because she ended up off of her medication. So there are many stories that are like that, and it would be really great if there could be a mandatory treatment prior to incarceration. Now, once they get out, if they're on probation or parole, they are followed by the Department of Community Supervision. They usually try to make sure they go to their treatment. But if they max out from their sentence, which means that they do not have probation or parole, then DBHDD tries to handle them receiving treatment. But a lot of times they do fall through the cracks, and so that is another area in which everyone who has been on mental health, whether they're on probation or parole or maxed out, if they could be followed, if they could have support, then that would be really helpful. And I know that the Forensic Peer Mentors is a program that is kind of a joint venture between GDC, DBHDD, and the Georgia Mental Health Consumer Network, that they are very helpful. And I see some of them in here, which is really good to see, because they meet the offender prior to release, and they help them to reintegrate into society, and they help them with being able to get their treatments and actually make it to their appointments or whatever their needs are, actually. And that has been very helpful. We just need more of it. But I think that even that funding has been cut. And so there's a lot of funding on the front end and the back end that would be really helpful if it could be in place. With that said, yes, go ahead.
Dr. Jackson, do we not outsource health services and mental health services to a third-party group?
There is a vendor that provides the mental health services, and currently it's MHM Centurion.
Yeah. Can you weigh in on how effective they are?
Well, sort of. I used to be an MHM employee when I was in the prison system. They had the psychiatrists, they had the psychologists, and now with the newest contract, they employ the activity therapists, the clerical staff, the counselors, the psychologists and psychiatrists. They are only as effective as the state has money to give to them. The ratios between staff and offender could be better, but they do what they can with the money that they are given and allotted for the services. Now, in terms of the quality of services, most of the time the staff are actually very qualified, and they usually get a pretty good salary, but it's probably not enough of them to provide the service.
Thank you.
Other questions?
I have a question. Sure. Hi, my name is Brian Tanackley. I work with the Reentry Partnership Housing Program. We provide housing for people coming out of jail and prison that are homeless. What percentage of people with mental health issues would you say are homeless coming out of prison?
You know what, that is really hard to say. If they are maxing out, I would say, I'm just guessing though, probably about 5%, because what they try to do is place them somewhere. And they start with family, and then if they don't have family, the few group homes that are available, they try that, and then last are the shelters, but those are not, especially for females, it's very few, and or they're limited. And so if they're on probation or parole, they actually cannot be released unless they have adequate housing in a shelter, and government housing are not considered to be adequate for their release, which also keeps them in longer, which does not help their situation in many cases.
I have a question. How does the Department of Corrections feel about holistic therapy? I feel that the medicine is okay, but researchers, when you research, you realize that there are a lot of people benefit from meditation, doing yoga, having therapy on self-help, I think that those treatments, either in or outside of prison, can be very helpful. Can you make any comment on that?
Oh, yeah. There have been groups, and it really just depends upon the location of the prison. Whether or not volunteers can come in, or whether there's a staff member that knows yoga, it just really depends upon where the prison is located for those types of things. But anything that can help, that has been shown to be helpful to the offender, is not something that would be kept from the offender if it's available in that particular area. Yeah.
But not everyone, I mean, for example, not everyone like chaplains or wardens or whatever, they have this idea that it's not helpful, you know. So therefore, they're not really into, or they might have a small group, like a effect and character group to have it, but not for everybody. So that's what I was trying to see, if there is some kind of idea that this is a good treatment and it can come into prisons for everybody, not only, you know, even mentally ill, but the people who are in general population that might be mentally ill, but they're not taking medication because they don't want to be signaled as a mentally ill person.
Yeah, a lot of it depends upon just the resources that are available in that particular area for the prison. That's about all I can say about that.
Thank you. So one of the things I want to, so what came up, you heard Dr. Jackson talk about DBHDD, and that's is it division or department? Okay, Department of Behavioral Health and Developmental Disabilities. I did invite them to participate, but conflict and schedules and, oh yes, okay, we got representatives in the house, yes. I had invited Monica
with Dr. Dillian.
So one of our goals going forward is really try to create spaces like this where we can begin to work better and more in partnership with some of the agencies that our folks are attached to, so that we can learn from the folks working in these agencies what some of their challenges are, and figure out together what are some of the solutions that advocacy organizations can play a role in pushing forward. I know there's only but so much you all can do as agency staff, but getting folks to recognize that we're all in this together. The other thing I want to point out is there's a commission that was enacted, the Behavioral Health Innovation and Reform Commission, that is charged with analyzing from front to back how the legal system has been impacted by the lack of services, mental health services in the community, and how all of that is translating into what we're dealing with on every level for kids, women, and men. And so there are, out on the table, I gave a list, because a lot of the work that's being done is going to be done with the subcommittees that have been put together, and they're holding meetings now. There's been 3 so far, I believe. But one that is definitely very important to us today is the one on mental health courts and corrections. And so that group is really paying a lot of attention to what's happening to folks once they get arrested, and what the process is on whether or not they get into an accountability court if there's one in their area, and then also what's happening on the law enforcement side, and then what's happening to people once they enter the correction system. And so it'll be important for you all to attend those meetings when they come up. I encourage you, if you, the lead rep and chairman over the commission is Representative Tanner, and his assistant is the one that usually sends out the notices for the meetings. If you contact, I can't remember, I better not call the name because I'm horrible with names. But Rep. Tanner's office is leading that charge. Or if you contact the chairs of those subcommittees and get on the mailing list for when those meetings are being held, I encourage you to do that. Right now, they're doing a lot of analysis and getting information from the implicated agencies, but also they're going to want to hear from the community, and they're going to need to hear from the community. So I encourage you to, keep track of that. They're going to be around for 4 years. But in the meantime, there's probably some stuff that we could be advocating for with legislators to get the ball rolling on some of the low-hanging fruit that we could look to in terms of meeting the needs of folks who are in or those that have the risk of going in. So I just wanted to bring that up. And so part of this discussion is also, we talked about physical health and the issue of women who are incarcerated in the state. There's a huge increase of women going in for a multitude of reasons. One of those addiction issues, substance use issues that are coming up. And some of the women have been pregnant. Last year I think there were 16, I think we have 11 now. Way more. Okay, I shouldn't count on data reports. Okay, so we do have a real concern about incarcerated pregnant women and what's happening to them during the pregnancy and after. One of the members of the JRP membership and a number of groups fought against shackling of pregnant women during delivery in Georgia, and the legislation got passed, and there's still ongoing work that's going on now to try to really bring dignity to the treatment of women and others in the system. But we want to talk about some of the ways that we could be thinking about how do we get people out of incarceration and who have severe and chronic health needs. And giving birth is one of them. As a mom, I can tell you, it is. But I want to invite my partner Amy Ard up from Motherhood Beyond Bars to talk a little bit about their work.
Hi, folks. I'm happy to join you this morning. I'm the director of Motherhood Beyond Bars. And since 2013, we've had a really laser focus on pregnancy and incarceration in the state. And it really started when a student from public health school in Emory visited a prison in Atlanta where all pregnant women are held, and realized that they were getting constitutionally mandated health care. This is a facility where nurses are in sight, but there was no health education, no support, no increase in activity. And so Motherhood Beyond Bars was born out of that experience, and since 2013 has been offering all of the support and education for pregnant incarcerated women in the state. We do have a data reporting problem. There are between 50 and 70 births per year on the state level. That is not reflected in the data that's published online. And until this year, we have offered 4 programs: prenatal education, postpartum support, which is held at Lee Arundel State Prison, where most of the women go, weekly yoga classes, and also monthly baby showers. And so what happens when you go into the prisons and you start talking to people is the scope of the problem really starts to be illuminated for you. What we were finding was the programs, the need expanded way past the experience of giving birth. Right now, we believe that the experience of giving birth while incarcerated can lead to other traumas. So self-reported women in prison, we already know, are a group highly impacted by previous trauma. Self-reporting data is up to 90%. These women have experienced trauma. And we believe that the experience of giving birth shouldn't be an additional traumatic experience, but right now it is. So all women are held in one facility, transferred to a hospital. No family members are allowed present at the birth. And right now they're permitted about 2 hours with their babies until they are separated for the postpartum period. So women are then taken to an inmate floor and babies are taken to the NICU. So there's no support for breastfeeding, skin-to-skin contact past that 2 hours. And if the staff allows, or if there's staffing levels allow, women are able to go to the NICU to visit with their babies until that they are then permanently separated for the duration of the incarceration. So they could be in the hospital for 24, 48 hours for a normal vaginal birth, and then the babies are most often picked up by a family member. We see that very few of the babies in state end up in the foster care system, and that is true for national statistics as well. So then the scope of the problem comes not only the trauma of the experience of giving birth, but then we have trauma that could very potentially be passed to the child for the sole reason that that woman was born, that child was born to an incarcerated woman. We have lack of skin-to-skin contact, lack of breastfeeding support. They are in a NICU, whether they need extra help or not, mostly because there's not a healthy baby nursery at this hospital. And then they are picked up by a caregiver who then falls outside of the normal supports for foster families. So these family members come and are not eligible for the foster care stipends or support or clothing that a foster care family might. And so then the scope of the problem for Motherhood Beyond Bars expanded to realize we have caregivers coming to pick up these babies who are already under-resourced, most likely, not eligible for the help, and are picking up a 2-day-old when the mother is incarcerated. And then there are multiple problems with getting that baby into visitation to see the mother. So it would not be unusual in our group of a postpartum support group. These women also do not get tested for postpartum depression. Just because they've had a baby does not qualify them for mental health services for postpartum depression once they get back. We have women in our group who would see their child once, maybe twice in a 15, 16, 18-month sentence because of the barriers put up to visitation with a newborn or an infant. And so we know that the fact that this child has been born in prison is already a factor that it could increase childhood trauma for them. And the statistics on this are grim. Parental incarceration is an adverse childhood experience. And we know that the more ACEs that a child has, the more likely they are to end up in prison themselves, for instance. 3 times more likely to end up in prison because they were born there. They are more likely to drop out of school. They are more likely to have substance abuse problems, and the list goes on and on. So Motherhood Beyond Bars is committed not only to the work inside the prisons, but as we started to see the needs outside the prisons, we are starting a caregiver support network for the family members that come to pick up these babies at the hospital, offering them immediate supplies of diapers, wipes, formula, and also a navigator, a person that knows what county they're going back to, because in our work talking to the women who are having these babies, we realized pretty quickly there are not a lot of babies staying in DeKalb, Fulton. They are going all over the state. So we need people who can help them hook up with resources in whatever county they're going to. And we've had some very productive discussions with DFACS about how we might reach those families. And then we have reentry. So when a mother is released from prison, how does she reunify with the family? And we've started looking around for reentry programs that focused on family reintegration, and we found almost nothing. So we'll be creating that too. There's a lot of work to be done. And in the process of talking about the real impacts of parental incarceration, we started looking around for programs that might be an alternative to incarceration. What would happen if we took a mother who didn't belong in prison in the first place because she had a substance abuse disorder or a mental health disorder? What if we could change the course for that family? What if we could make them not end up in that prison cell, not be separated 2 hours after birth, where a baby goes to the NICU and a mother goes to a prison floor? And so we started looking around for programs that existed in this city that might be able to help us out. And by chance, we ran into and found out about a program called the Mary Hall Freedom House. We started having communications with them. We have, and I would invite LaDonna Barnes up now to tell us about that program. She's a licensed professional counselor and the program manager at Mary Hall Freedom House, where she oversees clinical services for women who may be court mandated, and she also runs the RISE program. And so we were so enthusiastic about the work that the Mary Hall Freedom House is doing with pregnant and postpartum women, and thought if we can divert women into this program instead of prison, there is a lot of return on that investment. We do not lock someone up. The taxpayers don't pay for it. There is funding for the RISE program right now that takes women, it doesn't cost these women anything, and you'll tell them about that, to get the treatment they need, and they are not separated from their babies. They are not separated from these children. It focuses on the family. And so I invite her up to tell us more about this program, and we'll really be encouraging this legislature to look at alternative sentencing for primary caregivers. Georgia doesn't like to be last to do anything, but we certainly don't want to be first. I can point to a state just to our north that passed this legislation last year, Tennessee. Two things had to be true. You had to be a nonviolent offender, and you had to be the primary caregiver of a small child. And we know that in Georgia, that fits that description fits the majority of women that are in our state prison system right now. So I'm going to turn this over to LaDonna to tell us more about the possibilities.
Hi. My name is LaDonna Barnes. I'm really happy to be here with you all this morning, despite the crazy weather that Seattle, Georgia is giving us today. So I guess I kind of want to do three things. I would love to tell you more about Mary Hall Freedom House overall, and then dive a little deeper into the RISE program. RISE stands for Reaching and Intervening with Substance Using Moms Effectively. And then I would love to tell you about, our case study. She's not a case study, but for all intents and purposes, I would love to tell you about this individual who was referred to us from Motherhood Beyond Bars. And I would love to tell you the things that she has experienced and how we're working with her to increase her independence, to increase her parenting skills, and to work with her family in order to increase the chances that they can stay reunified after everything is said and done. So Mary Hall Freedom House has been around since 1996. We started with one apartment. One apartment, two women who had substance use disorders, and now we have grown exponentially. So we're located in Sandy Springs. Primarily, we do substance abuse treatment. We have a day treatment program, intensive outpatient, and aftercare. We provide community transitional housing for our participants who make it to that phase of treatment. Those beds are limited in numbers, but the women who are able to take advantage of that program are wildly successful. So that's an additional 6 months of not only treatment, but cost-free housing where they're encouraged to save their money. Some women reunify with their children. They buy cars. They get promotions, and it's actually a wonderful thing to witness. Mary Hall Freedom House also has a number of permanent and supportive housing programs. So we have 2 veterans programs, actually 3. One of them is an employment program called Troops. The other is a transitional housing program called VIP, stands for Veterans Independent Pathway. And then we have a supportive housing program for veteran mothers with children called Elizabeth's Place. We have 2 other permanent housing programs, one on the south side called Mary's Heart, and then one by our main office called Higher Ground 3. And again, those programs are focused on mothers with children, allowing them to, first of all, not be homeless. Second of all, giving them the skills that they need so that way they don't have to be homeless anymore and they don't have to go through that again. So that's Mary Hall Freedom House in a nutshell. Now I would love to tell you more about the RISE program. So SAMHSA gave us a grant in 2018, and RISE really focuses not only on the individual that is in substance abuse treatment, but the families. So the disease of addiction is a family disease, meaning it doesn't just affect the person that is using or faces consequences due to his or her addiction, but it's a trickle-down effect. So it affects moms, dads, grandmas, grandpas. I'm sure we've all read in the past few years about how there's an increase in the amount of grandparents who step in to take on the parent role because mom or dad is in active addiction, or worst case scenario, mom or dad is no longer around due to the consequences of their addiction, whether that be incarceration or overdose death, right? So SAMHSA said, great. You guys wrote us this proposal, so let's see it in action. And I'm here to tell you that RISE has done a wonderful job. We are now in year 2, taking a look at our year 1 results. We had close to a 50% success rate. We've been able to work with not just the families of these individuals, but the fathers of these children. We have a family and fathers advocate that reaches out to these moms and dads and grandpas and whoever their identified support system is, but not only them, the fathers of these children, because a lot of times the fathers of these children are either in active addiction as well, or they are seeking treatment and recovery of their own. So this individual that we have on staff works with our collaborative outreach coordinator to find them treatment, to find them reentry programs, to find them counseling. Because a lot of times those things aren't offered to the families and fathers of these individuals. We take these individuals, we bring them into treatment, they go through therapy of their own, they get their psychoeducational groups, they may leave in 90 days to 6 months, and they say, yay, I did it, but then we plop them right back into these potentially toxic environments, and we say, good luck. So the RISE program at Mary Hall Freedom House works really hard to make sure not only that the individual, who we might call the identified patient, that they're okay, but then we make sure that their families are okay too. We make sure what it looks like, that they know what it looks like to set boundaries with one another. We make sure that they know what it looks like, what postpartum depression could potentially look like. We give them the skills and we give them the education that they need to be successful as a unit, not just as individuals. Things about not only Mary Hall Freedom House, but the RISE program. So RISE focuses specifically on pregnant women or postpartum women. That means that the criteria to get in that program means you have to be pregnant and or you have to have given birth in the past 12 months. So we accept women with infants. We accept women with children. You can come to our program with up to 2 children. Right? What a fantastic thing. Women's issues are different than men's issues, right? Some might say that it's a lot easier for a man to get up and go to treatment and leave his children with the mom than it is vice versa, right? I don't have any concrete numbers on that, but I'm just telling you what I see on a day-to-day basis. Women don't want to leave their children with just anybody. It may be due to their own past experiences, because again, the disease of addiction can be a cycle, right? Occurring throughout multiple generations, or they may just feel bad. I've left my child so many times before, and now I have to do it again. And I know that it's for a good reason, but I just don't want to. So we allow these women to bring their children with them to treatment. We have an on-site daycare that's quality rated, and we have a wonderful child care staff. So the other thing that I want to point out about the RISE program at Mary Hall Freedom House is that these women have formed their own little cohort, which is nice to see, right? They're very supportive of one another. They're very protective of one another. They're very loving toward one another. And yeah, they're getting some extra things, but when I tell you that they are excelling beyond my wildest dreams, it's really amazing to see them successfully complete the program. Because the other thing is, we have these treatment facilities, right? And we say, okay, great. You can spend 30, 60, or 90 days here. But I've been using for 2 decades. 90 days, 6 months isn't going to undo all of that stuff. In fact, studies show that the brain takes at minimum 30 days to defog. So now that leaves me, if I want to stay 90 days, or I can only stay 90 days, that leaves me with 60 days to unpack all my trauma, to learn about my co-occurring disorder, because again, we talked about mental health here. It's getting worse. And Georgia didn't expand Medicaid, right? So a lot of these women who in other states would qualify for Medicaid no problem, they don't qualify for Medicaid here, which means it's hard to get them in to see a psychiatrist first and foremost, and it's hard for them to even afford their medication. So, I say all that to say that we really have to take a look at the differences between men and women when it comes to entering substance abuse treatment. The children in pregnancy, that's a huge deal. And we would be doing that population a disservice if we didn't pay attention to that and afford them more opportunities to enter treatment while expecting or to enter treatment with their children. And then the mental health, again, is a really big deal. These women cannot afford medication. And even if they're here for 6 months, oh, by the way, RISE allows you to stay in treatment for up to a year. Up to a year. Because again, somebody's been using for 2 decades, 6 months is only a drop in a bucket. I just really want to applaud everybody in the room for the work that they're doing and just encourage everybody to keep going. Mental illness and co-occurring disorders is a huge, huge barrier. And if there is anything that we can do in order to work better together to make sure that these women have the correct diagnoses and the correct medication and affordable medication, and that they can afford it when they leave incarceration or they leave a place like Mary Hall Freedom House, that really is the way to go in my eyes. So I just appreciate everybody having me here, and if anybody would love to know more about Mary Hall Freedom House, I'll be right with that with you. Thank you.
So now I want to invite Ira from Southern Center for Human Rights. Ira, you ready? I've been juggling our agenda. You know, you plan, God laughs, juggling our agenda around. Ira doesn't need this. I just like seeing it.
Hello, my name is Ira Berkeley. I'm the Public Policy Associate with the Southern Center for Human Rights. It's great to see you all here today. Basically, I'd just like to give you a bit of a rundown about what's happening here at the Capitol. There's quite a few bills moving. Crossover Day, which is kind of the deadline for bills to pass from House to Senate and vice versa, is actually this Thursday. So this is a really hectic and busy time. If you get a chance to walk around at all or are interested in lobbying after this, you're welcome to. So I'll just give you all a rundown of some of the bills that we're personally following and highlight a few that are kind of related to behavioral health and the criminal justice system. So one key bill that recently passed out of the Juvenile Justice Committee this Monday is House Bill 440, which was introduced by Representative Mandy Ballinger. That bill raises the age under which a young person receives like juvenile code, so is treated in the juvenile justice system as opposed to the adult system from 17 to 18. Georgia was one of like the last few states that kind of had that at 17, so that's a really important potential change. We're also tracking Senate Bill 288, which was introduced by Senator Tanya Anderson, and that bill allows for the automatic restriction of certain misdemeanors and felony charges and convictions. That bill, I believe, just passed out of the Senate Judiciary Committee and has language that's adopted from House Bill 528, which was introduced by Representative Mandy Ballinger on the House side. It's very similar legislation at this point. It restricts records for individuals who are convicted of certain felonies and misdemeanors with some exceptions. Recently, the bill was changed to have a much narrower scope than it initially did. It's now limited to misdemeanors. Before it also included restrictions for some felonies, and at this point it only includes 2 misdemeanors for someone's entire life. So you're eligible essentially to have 2 misdemeanors, up to 2 misdemeanors expunged after 4 years. There's also a good number of bills that we're currently opposing. One of those that was introduced, I believe, late last week, is that right, Marissa, is House Bill 1040. Was that last week? Okay. And that bill would extend the time private probation companies can collect fees for pay-only probation from 3 months to 6 months. And that bill passed out of the Judiciary Non-Civil Committee last Thursday. It will next be heard on the House floor. We're really concerned with this bill. 3 months to 6 months may seem like a short amount of time, but that, I think, that really is going to target people who are already unable to pay their fines and are only on probation because they were unable to pay initially. This bill could potentially double the private probations industry profits and would really exploit poor Georgians who are, again, only on pay-only probation at this point. We're also very concerned with House Bill 720, which was introduced by Representative Stephen Saines. That would increase the use of probation for people who are convicted of sexual offenses and allows probation for life for felony offenses and outlines a risk assessment tier system. I believe it was last week the House Judiciary Non-Civil Committee reported favorably on a substitute for that bill. We're also very concerned with Senate Bill 402, which would end the use of signature bonds for all offenses, including misdemeanors and ordinances that passed out of the Senate last week and is awaiting hearing in the House Judiciary Non-Civil Committee as well. We're also very concerned with House Bill 994, which was introduced by Representative Burt Reeves. That bill creates 2 new gang offenses and adds 5 new offenses to the list of crimes that require registration on the state sex offender registry. It also prohibits certain gang offenses from being merged and establishes much harsher civil penalties for people who are alleged to have committed criminal gang activity. And it also really unnecessarily expands the definition of it with what criminal gang activity means. Fortunately, advocates and some of our JRP partners actually were able to remove some really harmful language from House Bill 994. That language would have forced the automatic adult prosecution of children who are ages 13 and older for 33 brand new offenses. It would have allowed prosecutors to charge people with gang offenses that didn't even occur in their county, which is ridiculous, and would have made criminal gang activity an aggravating factor for the death penalty. So thankfully that language was removed, but there are still a lot of concerning language that we're really concerned with at this point. So I would definitely keep an eye out on that, and we'll keep updating you. We have like a legislative update that we put out every week, as well as calls to action so that you can know which legislators to reach out to. A few bills that are related to healthcare that we've been tracking this session are HB 178, which creates a unit within the Department of Behavioral Health, and that unit would study the current practices and act as an advisory council to research different issues regarding mental health, including providing service and treatment plans. House Bill 760, which was introduced by Representative Sharon Cooper, that bill would allow peace officers to transport any person to a physician or psychologist if that person is accused of committing a criminal offense in certain circumstances, and it seems as though they could benefit from treatment as opposed to being taken straight to jail. We also have House Bill 714, which was introduced by Representative Nguyen, and that bill restricts the use of solitary confinement for punishment for vulnerable people, and includes those and vulnerable people in that context includes folks who are dealing with serious mental illness, children, and people over the age of 65. As Tony mentioned earlier, solitary confinement really is a mental health issue. It's often used to treat people who need treatment and not to be confined in conditions that further exacerbate what they're going through. We're also following House Bill 702, which prohibits capital punishment, and the state end would commute capital sentences to life without parole. So those are just a few examples of bills that we're following this legislative session. I'll definitely be around after this if you have any follow-up questions for me, and I can imagine our public policy director, Marissa Dotson, will be around as well. But,
Thank you. I want to point out, hopefully everyone signed the sign-in sheet out there, and if you included your email address, we're happy to send updates. Southern Center really keeps all of us on our toes about what's going on here, and there are a number of membership organizations that stay here at the Capitol, tracking what's going on, preparing the public and the community to respond to various activities that's happening, whether there's a last-minute hearing that's scheduled, asking people to come down if they can to share their voice, or sending an email or making a phone call. It all matters. I mean, it's always exciting to me to get an email back from a legislator that says, I did vote no. So it's just important, and it's a fast-moving time, and no matter what your position is, you're a resident in this state, you have a right to have a voice. So you can act individually as a person who cares about what's going on to people in our communities here. Our other partner, the Fulton County Pre-Arrest Diversion Initiative, is here and going to talk about pre-arrest diversion here in the state and some opportunities. I think we have to expand and build upon what we know is working.
But I'm Moki Macias. I am the executive director of the Fulton County Pre-Arrest Diversion Initiative. It does not fit on a t-shirt along there, but we affectionately call it PAD. And you'll see, I don't know, how many folks are coming from other parts of the state, not Atlanta, Fulton? Everybody kind of local, a few folks? So Savannah and Athens, as well as a few closer in counties. I know Rockdale has been in conversation about similar, but Savannah and Athens are probably as farther along than anybody else in the state besides us around also establishing a pre-arrest diversion program. So something to look at as you connect with other folks across the state. I know that last week the city council in Athens actually authorized the pre-arrest diversion program there. So it's good to see there is some movement around the state and definitely some interest. What I'd like to highlight today is to give you a little bit more context about why diversion at this sort of stage in the process. And really some of the core values of the way that we do it. I think diversion, it's really exciting to see the way that folks are interested in diversion and the way that people are thinking about it. But I think there are some sort of core values about how and why we should do it, that if those get lost, we may end up just sort of recreating a kinder, gentler, punitive system. And I think that's a concern. So yeah, I don't know if everybody has gotten a copy, but you can kind of follow along with me. So pre-arrest diversion, what we're doing here locally is based on the LEAD model, which stands for Law Enforcement Assisted Diversion. It comes out of Seattle. So in 2013, it was the first year that Seattle implemented this initiative. And it came out, in Seattle, it came out of a lawsuit that was about to be filed against the Seattle Police Department for racial discrimination in drug enforcement. And think about Seattle, it's a pretty white city. And what they were seeing was similar to what we've seen all around the country, that the drug laws have been used as a racist method of controlling black and brown folks, right? And so instead of moving forward with this lawsuit, the police department, the prosecutors came together with some of the civil rights groups in the city to talk about what else they could do to address street level drug involvement. And so from the start, law enforcement was very much involved, but it was out of the sort of taking the lens of behavioral health and a recovery-focused lens, right? And so the idea is simply that police officers are the first point of contact for most of our behavioral health issues that people are experiencing on the street, right? If I'm dealing with a substance use issue, but I happen to own a big house and live in a fancy neighborhood, I am not doing drugs on the street, right? I'm doing it behind my locked door. If I have a mental health concern and I have access to mental health care and family support, and simply the financial resources, like folks have alluded to, I have a much better chance of not getting arrested for behavior driven by my mental health issues or needs, right? And then, as we also see on our, every time you walk down the street, when people are experiencing homelessness, when people are poor in this country, there are so many ways that you can get arrested just for that, right? Just for experiencing poverty in this country, right? Because we don't have the housing that we need. We don't have public bathrooms the way we need to. We don't have safe places for people to just hang out during the day, right? And so instead what we have done, and the representative alluded to this, but what we've done is just criminalize every single behavior that is associated with survival, right? So we've criminalized urinating on the street, and there's nowhere else to urinate, right? We have criminalized walking on the street, right? When oftentimes, there aren't sidewalks to walk on, right? Pedestrian in the roadway is a state charge. We divert people for it all the time. We see people, you go to municipal court, you see people every single morning at first appearance who have spent the night in jail, who walk into the courtroom in shackles, because they were a pedestrian in the roadway. Is anybody looking at whether there was a functional sidewalk where they were walking? No. But is it clear that for me walking down the street, if I step out into the road and walk alongside it, am I going to get arrested for pedestrian in the roadway? No, I'm not, right? Because I don't fit the profile based on race, based on gender often, and I don't look like I'm homeless. I don't look like I'm poor and struggling to survive and maybe seen as a nuisance or unsightly or make people uncomfortable, right? And so all of these activities have been criminalized if you're poor, right? And people's substance use and people's actions related to their mental health when they're not able to hide it behind closed doors, that they become the focus of police targeting, right? And I will say after the last 3 years working very closely with the police, I do have more empathy for where they stand, in that there is an expectation of our police departments to do the impossible, right? Which is to use the tools that they have, which is arrest, and to address all of these complex social needs, right? Because it's about public order, right? It's enforcing public order. And when all of these needs become about order, then the police department is, their hands are a bit tied, right? They are the ones getting the pressure to make these problems disappear, right? Which is inherently, it's not going to work, right? And so in terms of what we're asking the police to do for arrest diversion is we're acknowledging that they're the first point of contact, right? We're acknowledging that officers are tasked with an impossible task, and we are trying to then give them another tool. It's simply that, right? So instead of arresting, an officer is able to call our team out, where we'll have a short conversation with that officer, and we'll come meet them at the scene, or sometimes the officer can bring the individual that they have probable cause to arrest to our office. We are not trying to widen the net. We are not trying to turn police officers into social workers, right? We're not saying, go out there and look for somebody who needs help. We are saying, if you have probable cause to arrest somebody, you have the opportunity to do something different, right? And I think this is a key piece of these diversion programs, which I think it worries me sometimes to see, people are like, oh, that sounds great, perfect. We'll just, we'll get the police to kind of make this connection, but then they are still a little bit stuck in a punishment mindset, right? They're still a little bit stuck in, well, then somebody's diverted to us, and right, it's about merit, right? Do they deserve it? And will they earn it? And I think the fundamental sort of shift that we need to make is that these sort of issues, right, like these sort of activities do not merit punishment, period. Period. We can take public order issues seriously, right? We can say, absolutely, do communities, do we want to sort of deal with the public health risks of people using the bathroom on public streets? No, right? We can take those concerns seriously. Do we want needles on our, in our playgrounds when we're taking our kids onto the playground? No, we don't. We can take that seriously. But these sort of issues do not merit punishment. And so when people are diverted, it's not about them earning it. It's not about whether they will comply. It's not about whether we will, that we know what's best for them, and so there's hoops that they need to jump through to prove to us. I'm sorry, you're a pedestrian in the roadway. I don't believe that you don't owe any of us anything, right? Well, you may need some assistance because you may not have a home that you're to live in, right? But it's not about punishment, and so the LEAD model, I think, is a really, it's a very good, I think they've done a very good job of making that work on the ground, right? So what it looks like when somebody is diverted is that once they do an intake with the kind of case management side, that charge goes away, right? For us in Atlanta, I think we took it a step further in saying that once that person is connected to us, there is no police report filed at all, right? No police report. There's a field interview form, which gets kind of in the weeds, but it's basically if an officer were to stop you and have a conversation and not do anything, they would file that form. That just basically says, like, it documents the conversation, but it is not at all a criminal document, right? So once that person's connected to us, there is no charge, right? There's no clawback option. There is no like, oh, well, you didn't comply with this, so now we're going to bring you back in and send out a warrant. None of that. It is the pathway out of the criminal legal system, right? And for that charge, there's just nothing else. If somebody connects with, and it's happened before, if somebody connects with us, let's say we pick them up they had a possession of drug-related object. This is another one that gets me, right? So you don't have any drugs, but you have a drug-related object, right? I can have a completely clean, tiny little glass stem. No drugs in sight, right? That is still something that's making it arrested in jail, right? So let's say we get connected to somebody with who was diverted on possession of a drug-related object charge. We go around the corner, we got them in the van, we're chatting with them about, have you eaten today? Is there anything right now that you need? What can we start talking about kind of basic needs. And they say, you know what? I changed my mind. I don't want to do this. Let me go, We are going to pull over and we're going to let them out of the van. And our law enforcement partners don't like to hear us say that, and yet we tell them that because it has to be about consent, right? That it has to be about people choosing. And oftentimes, we've had many times now where folks have said, no thanks, but no thanks, and then we don't see them. And then 3 months later, either they're walking back into our office because something else shifted, and they're like, maybe these folks can help, or we get a text from one of our prosecutors in city court saying, oh, didn't you divert so-and-so? They're here in court. We run down to court and say, hey, so good to see you again. What do you think? Are you interested in working with us today? And then we'll advocate for them in court to say, hey, we want to keep working with them. We're available. We don't know their promise, but we are able to say, we will keep working with you. No matter what, we'll keep working with you. And so, for us, what that means working with them is really figuring out what people's basic needs are, figuring out what people's personal goals are, helping them reconnect with family and friends and support systems if at all possible, and then staying alongside them, working with them on their goals. There is no length of time for the programs. There is no requirements in terms of participation. There are certain benefits that we provide in terms of housing, MARTA cards, food assistance. And we expect folks to, if they just are not meeting with us at all, it's harder for us to provide those kind of benefits, right? But the expectation is that we will try and get somebody on their feet sort of intensively over a 3 to 6 month period. And then as long as they keep engaging with us, we're going to keep doing everything that we can in terms of referring them to resources, connecting them to resources. But then the last piece that I want to mention on that piece is that what we have found probably our biggest value has been to the folks that we are working with is the legal navigation. We don't have any attorneys on staff. We have a lot of caseworkers. But we work very closely with the public defender's offices. We work very closely with the prosecutor's offices. And we work really closely with the courts. And what we have found is that when people are coming to us, they have already been arrested. They have open cases, right? They may have complex civil legal issues as well, right? Whether that's that every time they get a day labor job, half of their check has been taken for child support, right? And we had a gentleman whose the mother of his children had died. His children were in their 30s, and he could not take a job that was not under the table because his entire check was being taken by the state, right? Just to pay back the state. That's not going to his kids. It's not going to his family. To their mom. It is just going to the state, right? And yet the man keeps getting locked up for panhandling because he's like, there is literally no way for this man to make money legally and not have it be taken by the state, right? So people come to us with complex civil issues. They come to us with complex criminal issues. And oftentimes, when we're working with them, they continue to get arrested. There's on one of these, there's this, I love this graphic of kind of talking about the stages of change. And we've talked about this with our law enforcement partners, because, they get kind of stuck in this mindset of like, well, we gave them a chance and they're not using it. And it's like, just to be thinking about, like, realistically about change and like how we as human beings change, right? It takes us a long time. Like, I would invite people to think about, like, thinking about managing your own health, thinking about managing your own finances, thinking about, cutting back on sugar a little.
Wait.
What does it take? What's all the mental talk? What's the chatting with friends about it? What's the I'm gonna get an accountability buddy, right? I'm gonna get an app on my phone, right? All of that, and then you're like, oh, why am I binging on, ice cream that Saturday night at midnight? What am I doing? What about all my apps and accountability partners, right? So but just thinking about how human beings change, right? And that's, without even including the question of trauma, without including the question of self-medication, right? Without including about who you're connected with and who's going to support you or not support you, right? All of those pieces. Just thinking about that, what we know for sure is that folks are going to probably continue to engage in some behaviors that would likely get them rearrested. One, because too many things are criminalized. Because change doesn't happen like that, right? And so, so we try and really bring that home to our criminal justice partners, our criminal legal partners. But we also do a lot of navigation, right? And that's the piece that I think is really important for thinking about diversion on the front end. I talk to people and it's cute. They're like, oh, that's just so awesome that you're doing it. It's like you're getting to people before they get into the system and keeping them out. And it's like, oh no, we're working with folks who've been in the system, who will continue to interact with the system, and we are walking alongside them in a constant sort of struggle of saying, these are the kind of issues that shouldn't be happening. It shouldn't be getting people connected to the criminal legal system. And there will be kind of a constant struggle to keep people out of it until we decriminalize the kind of activities that we're talking about, and until we are able to lift the bar, right? And to be able to basically provide the kind of resources that people need, right? We are seeing folks arrested in Fulton County for so many behaviors that are related to mental health, and yet we do not have a crisis center in Fulton County. The county does not provide any crisis services. And it's painful to us because sometimes we get phone calls where we know this person shouldn't be going to jail, and we're not a crisis team, right? We will navigate the officers to who we'll be calling Grady, we'll be calling the GCAL line, but if we had appropriate crisis services in this county, we know for sure that police wouldn't be bringing people to jail. They would be so thankful to bring folks to the crisis center, right? And folks would be able to access these resources themselves. The other challenge for us with criminalized diversion is that it is based on law enforcement connection, right? The officers need to think about it, agree to it, and reach out, right? What we want, what we see, what our long-term vision is that the kind of services that people actually need are available to them when they are ready for it, and that there are no barriers to them accessing it, right? In the meantime, we have to go through all these gyrations to get people as close as possible to the services they need and to keep the kind of claws of the system off of them long enough for them to have a chance to do it. So I think it's not perfect. It's not, I never thought that this would necessarily be the work I was doing, to be so closely kind of in this system, but it's harm reduction. And I think that's the key, right? That is harm reduction for the current system that we're in. And what we want to see, as this kind of proliferates around the state and the country, what we want to see is not losing that value of this is not about punishment, and so it's not about compliance. When we divert people, it's not about compliance, and I know, there's kind of mixed feelings about accountability courts, but I would hope that as we can, like the next evolution of accountability courts is really just how do we get people out? And it's not about them complying, it's about them connecting to care. Thank you.
Any questions?
I want to thank you for your input because I work in the criminal justice system, and that's one of the barriers that I encounter, that once the person is put in, treated for their substance disorder, and then the system needs to be trauma-informed to find out what really happened. Because the system just puts a Band-Aid on it, and once it gets a little drip of rain, they're back. And it creates a vicious cycle, and that's my job, to change the system. My vision, change the system.
Yeah, I appreciate it. Yeah, it's like we want to treat people like problems to be fixed rather than as complex human beings like we all are. Yeah.
Any other questions?
Hi, what police agency do you work with right now?
So right now, we're working with the Atlanta Police Department primarily. We will, we're open to accepting diversions from MARTA, from Georgia State. We haven't set up, we don't have agreements with them yet. But for the most part, APD is the primary arresting agency for both, the city jail and the county jail. So that's really our focus. And believe me, they're arresting so many people that they could be diverting, that our work's still cut out for us there.
So one thing that you mentioned was talking about how people who are experiencing poverty or people who are experiencing homelessness are treated as being nuisances. What kind of harm reduction strategies can be taken to change a cultural perception of people who are experiencing homelessness?
Yeah.
Can you repeat her question?
Yeah. So I think the question was just related to the sort of our just sort of cultural narrative about people being human beings being nuisances, right? The kind of quality of life stuff, right? And I think I think that is the hardest thing, is that it needs to be conversation. It needs to be, we go to a lot of neighborhood meetings, and it's really painful, to hear the way folks talk about it. And I think I think that there has been such an over-reliance on police to enforce public order that it is truly, I think it's really challenging, because when you say that the police are going to get out of that business, the expectation often is that we will have the response as the alternative will do the same thing, which is completely disappear people. And I think that's the change that needs to be made, right? Is that acknowledgement that is actually never a solution, and that it is our responsibility as neighbors to just have more grace around the folks that we're living next to, right? And I think as the alternative, and as people who believe in people's wellness, like long-term wellness, right? I think that we can't hold ourselves to that standard, right? That, that means, we need to come and whisk people away and make sure that they don't go back to the neighborhood. I'm sorry, these are your neighbors. Yeah. So we need to reorient ourselves as a culture about what it means to see people who are struggling to survive, and that it is not about your comfort of not having to see that. And I think that has been one of the real ways in which we've been harmed by over-policing as a culture. That there's that expectation, which is just totally unrealistic. So I think it's slow, long work of continuing to humanize people, and changing that mindset of disappearance. Yeah.
I was just going to say, I have a question, but just to kind of piggyback off of you. Empathy goes a long way. Yeah. So, a lot of people feel like, well, this is a choice. And I would go out on a limb and say, a lot of what you see, and of course what I see, is not necessarily a choice. When we talk about the disease of addiction, once you picked up, your choices are gone. And I think that for the most part, some people want these individuals to get the help they need, but they're very quick to say, not my backyard. So if you're not willing to be a part of the solution, it's important to ask, what exactly are you suggesting? I always love to hear people talk, because when you listen, you can kind of hear those underlying biases. And if those individuals are willing to listen to multiple sides of the story, which is why I feel like certified peer support is so important. when you can bring someone into a room who has changed their lives around and put them in front of people who have these preconceived notions, you're essentially proving them wrong, right? Some people feel like there really is no way out for these populations that we serve. But I think that we work very hard as providers to show them it doesn't have to stay this way.
I just want to say, as a receiver of the services that you're providing and working as a forensic peer mentor, we're pioneering through this, and being the change that we want to see in the system is starting one person at a time.
Yeah.
I do want to say that.
Yeah.
Thank you.
Yeah, thank you.
Thanks for being here.
Yeah. Thank you.
So this is exactly what we're shooting for, and trying to create more spaces like this to have these kinds of conversations. One of our challenges will be to get some of the lawmakers in here to hear some of this.
Yes.
This was a hard week. This was a hard week for us, and we're definitely going to create more opportunities for that. Right, Melissa, we're going to think of ways to keep this going. We really want to do more to engage. It's exciting to see students here from
Appalachian State.
Appalachian State. Woo, I don't know what y'all call it. To come out, and we'll definitely keep working to engage other schools. We have so many leaders that we all should be bringing along in this, because, I mean, we're complex human beings. These are complex issues, but they're not insurmountable issues. It's really about getting our state to change its priorities. Period. You know, I'm convinced of that, and I believe that wholeheartedly, and getting the state to recognize the dignity of being a human being. And even as Moki has said, it's not us or them, it's all of us. It's all of us. That's just what it is. We want to use this time. We weren't sure how many legislators, if any, we would get here. The timing conflicted with when they needed to be in session. But for one thing, we want folks, while you're here, and if you have the time, to speak to your legislators and make that a commitment during each session, you know, to find out what's going on and set up an opportunity to go meet them there. But meet them in your community too. Yes. Like, they need to see you in their local offices as well. We want to use a little bit of time. People have announcements, and the elephant in the room, COVID-19. We all have had our own private little discussions come up. I want to talk a little bit about that, and then I have some other people that may want to make some announcements, and if anybody has any other questions, suggestions for other talks that you might be interested in. For those of you that are with agencies, if there's something you want to partner with our Justice Reform Partnership on doing and bringing into the community, we welcome that and are happy to do that. Just let us know. But so let me get out the way, and COVID-19.
Hi everybody. My name is Jennifer Surratt. I'm at Emory University. And just a quick plug, the meet and greet flyer that's out there, that's me. So if you have questions about that, feel free to ask me, and please share widely. I mean, of course, I am now thinking we might have to cancel because of COVID. But if we don't cancel, what that event is supposed to be is just people to get in the room together, learn what other people are doing in criminal justice, and kind of just figure out how to network and collaborate. So I am not an infectious disease specialist. My work is actually intellectual and developmental disabilities in criminal justice, and I've actually have a project with Dr. Jackson right now. So it's really great. But I do collaborate with some infectious disease specialists, and I teach a class on health in prisons and jails. And so I'm hearing a lot about people being concerned about COVID-19 in incarcerated settings. And the reason why is because it is a perfect setting for the disease to really go rampant, particularly when you have a high rate of immune-compromised people with high rates of HIV. Spike tuberculosis is a real big problem in prisons. And I don't know if the state is, I don't want to put Dr. Jackson on the spot, but I don't know if the state is thinking about this or has a plan, but I did get, somebody did send me a letter that residents of California are sending to their governor. So I thought what I would do is read that out, and then if somebody wants to take this and make it Georgia specific, I can help distribute it. So, and we can all help distribute it, and this might be something that we want to send to our governor. So their letter says, we are writing to you out of our heartfelt concern over how the new coronavirus may affect people who live and work in California's prisons and jails in light of the current state of emergency in California. Prisons and jails are known incubators and amplifiers of infectious diseases. Once a virus like the one causing COVID-19 enters such a facility, it is almost certain to infect the entire population and employees despite its best efforts to contain it. Thus, in China, where the virus originated, hundreds of people in prison have reportedly been infected. The good news is that the death rate for COVID-19 appears to be low among healthy people under the age of 70, with many people asymptomatic. The bad news is that a substantial percent of people known to have contracted the disease require hospitalization, and the death rate among elderly and those with pre-existing health conditions is fairly high. Particularly susceptible are people with cardiovascular disease, diabetes, hepatitis, chronic obstructive pulmonary disease, chronic kidney disease, and cancer, all pretty high in our incarcerated citizens. Were the population of a prison or jail to become infected at a time when the virus is widespread outside and the hospitals are already pressed to their limits, the death rate could be substantial. Many of those incarcerated are elderly and or infirm, and as a group, they are likely to be given lower priority when medical services become scarce in a broader community. We ask that you act quickly to protect those people in our prisons and jails who are at the greatest risk. In particular, we ask you to consider immediately ordering a one-time review of all elderly and or infirm people incarcerated in California with an eye towards providing medical furloughs or compassionate release to as many of them as possible. Doing so will not only protect them, but other incarcerated people, officers, and staff by decreasing the strain of resources within these facilities once the virus does hit. We hope that particular consideration will be given to the high percentage of elderly women and men currently in prison who have already served decades behind bars. Final paragraph. Other countries with high incarceration rates for COVID-19 have already become widespread and have been forced to reckon with the special problems presented by prisons and jails. For example, Iran announced on Tuesday it was releasing 54,000 prisoners in an effort to combat the spread of new coronavirus disease in crowded jails. Thus, we are asking you to move swiftly. Ordering a one-time review does not mean releasing people just yet, but nor can a review be accomplished overnight. If you decide the idea has merit, the review would need to begin immediately. So, I think that's a pretty good letter from California.
Absolutely. Who authored the letter?
You know, it just says a bunch of, I don't know who authored it, but then a bunch of people can sign on, and you can click whether or not you're formally incarcerated, staff, medical, you know, all this kind of stuff. So, this would be something I think good to modify to make it Georgia specific.
Absolutely.
I mean, again, not an expert, but does anybody have any questions?
Well, I think we could, we have folks' emails, and maybe as a partnership, we could do something.
Okay, I just heard from the infectious disease specialist that I know. She had sent along some information to a colleague of mine. And she said that I am allowed to share this one-pager that she sent. If y'all would give me just another minute.
Well, while you're doing that, too, I just noticed that, well, yesterday, I know that GDC, they had a lot of meetings about what to do, what flyers to put out, and in looking on gdc.ga.gov's website, it actually put in a link that's automatic to the Department of Public Health. It has quite a bit of information on it as well about the virus.
Are there any, I mean, I guess they're making plans in these meetings, right? Cool. Okay, so this is a one-pager, and again, I apologize for just like reading to you guys. This is what I had. A guidance for coronavirus clinical care on corrections that was written March 9th. As As of the start of this week, beginning March 9th, there is sustained local transmission in only a few metropolitan areas, and the risk of patients and healthcare workers acquiring the new coronavirus and developing the associated disease known as COVID-19 is still considered low. Nonetheless, here are some general interim guidelines. I will say also, I had a class, I was taking my class to visit GDCP, and they canceled that. So they're canceling tours already. Okay. Which is one thing. So basically this goes over when people come and arrive, don't have them wait in the general area. If people arrive and have a fever or cough and have symptoms and have known to be traveling, then quarantine them. If they have not traveled but have a fever or cough, then be masked and cared for as usual. Try to find rooms with closed doors for evaluation and keep the mask on. Notify all kinds of people. Relocate the patient. If it's a possibility, performing terminal cleaning of the room with hospital-grade disinfectant. A little bit more on the healthcare workers wearing masks during direct contact. Questions to ask about what symptoms people are presenting, washing hands, wearing gloves. If the suspicion of COVID-19 is high, if the patient is unstable, plan to transfer to a local emergency department, call ahead. Stable patients with mild influenza-like illnesses may be sent back to a cell separate from general population, a room with a door when possible. Provide soap and water and tissues. Don't be in contact with other people. Other considerations, have a low threshold for calling the Board of Health Department for test kits. They're in short supply, but use them wisely. So yeah, that's what I got. So anyways, if anybody wants to take on that letter, please let me know and I'll report it to you. Okay. Somebody may already be working on it. Thank you.
Thank you.
Well, Thomas Jefferson once said, I don't care about the history of the past, I care about the dreams of the future. My name is Brian Tenapoli. I'm with the Georgia Department of Community Affairs. I work with a really unique program called Reentry Partnership Housing. And in a nutshell, it's a program that provides housing for people coming out of jail, prison, or they've been remanded to an accountability court. We talk a lot about those. And if they're homeless or do not have a housing plan, they're eligible for RPH for 3 to 6 months, depending on their tier level. We have a unique partnership with 4 different agencies, our agency, Community Affairs, and Department of Community Supervision. We have friends here today. Mary, thank you for your hard work. And the Council of Accountability Courts, and then the Georgia Department of Corrections. So our agency, we're more the financial piece. We reimburse the providers each month. And we've grown the program. We had 27 providers in 2017, and we've grown it now to 46 currently, and we're still growing. But we really need more providers throughout the state. We don't have providers in Cobb County or Gwinnett County. And we're also, my main focus is to recruit new providers for the program. And you can either be a nonprofit, for-profit, or even a sole proprietor. And we reimburse up to $675 per month per individual. So someone who owns a house that was willing to open this up to RPH housing, they could theoretically put 2 people per room. We would reimburse, up to $675 per person, and the provider provides the housing and makes sure they have access to food. So the program is very unique. The state of New Hampshire is going to be emulating, copying our program in Georgia, and we first started this program in 2006, and we were a trailblazer, the only state in the country doing this. So it's a really unique program. The majority of the individuals in the program, it's only for individuals to move on to housing or be united with families, so they move on to more stable housing. And they're doing really well. They get jobs, and it's really a win-win for everyone. And I say this all the time, criminal justice reform is probably one of the few bipartisan issues that everyone can come together on this. So it's a really great program, and if you know of a provider or you are a potential provider, we have our intent to apply, which is this month in March. We have an online form you would fill out. Then we would invite you to a workshop, which will be held in April, and then in May the application will be available. We also have a fall cycle beginning in September, October, and November, and the intent to apply to applications and workshops, and then the applications available. So I appreciate your time, and this has been a very great event today. I've met a lot of great people. And is there any questions?
And where do you go, what site? RPH Housing?
Yes, it's on our, you can go to our website. I can get with you after I have a flyer with more information.
Okay.
And can send it to you. Yes, ma'am.
The problem that we're running into at the Arendelle, and
Yes.
here at the Arendelle State Prison, is that we are not allowed as a non-Department of Corrections employee to contact RPHRO. It has to come through it from a GDC email address,
Yes.
which we do not have working at the prison as contractors. So it's become really hard, and at the incarcerated individual level, the returning citizens have to be so far past their TPM, which is tentative parole month, for those who don't know that. And it's really become cumbersome to navigate through the RPH system from the inside the prison setting. And is there anything that can be done differently where that's concerned? And please don't let them be a sex offender, because then you're not going to find anything for them. So, I mean, it's really a hard, I mean, we have ladies that we're working with, they're like 180 days past their TPM, but because there's no facilities that can house a sex offender, I mean, it's just really a cumbersome process from working from inside the prison standpoint.
Yeah, thank you for sharing it. Our agency, we don't make the placements. That's the Department of Community Supervision does that. Although I did meet someone else here today who mentioned the same thing. I will definitely look into that because I believe there is a big disconnect. There's a lot of people, there's so much turnover. Counselors don't know about the program. And then a lot of supervising officers. I was one back in the day. Someone was released, they got $25 in a bus ticket. So at least this program isn't stabilized. It's a step in the right direction, but there's so much turnover with officers. They're not, I'm trying to go out and educate the officers about it because a lot of them don't know about it. But thank you for letting me know. I'll definitely look into that if you can get with me after this.
Sure.
And I'll get your contact information and contact some people.
Just think it could be a little bit easier to bridge that gap. For those of us who work, I mean, the forensic peer program, we work inside the prisons and we're not allowed to contact you all.
I know. There's a quote, do simple better, and I agree we need to definitely simplify that.
Sometimes it's just practice changes, and it's probably an administrative person that can make the decision to change that, so.
That's right. I'll get your contact information. Yes.
Really quick, put your hand up. I'd like to thank you.
Yes.
Because I actually have the application for reentry housing, and I've actually contacted you. And you put me in touch with Ashley, who helps me.
Oh, very
So
good.
it has worked, and I do the same job that she does. So it's a matter of resources and communicating.
Well, I've heard the quote too, the roads are out there, we all have to build the bridges.
He's not in the Griffin area.
Spalding, we believe we do have a provider. We do have one. We're not allowed to release the provider list because DCS, they don't want to get inundated with requests, so it has to be more of a formal process. I can tell you what counties we have providers. Get with me after, I can send you a map of the areas where, what counties we have providers. But we really still are needing new providers, so please let me know if you know of anyone or you're interested in yourself. Yes, ma'am.
So while housing is really important, the other services are too. So does RPH connect these men and women to other resources, like if they need treatment, if they need benefits, if they need mental health services? Like, is there a part of this program that does that? Or is that something that one of the other partners that you mentioned is responsible for? And just how do you guys navigate that continuity of care to make sure that they remain stable?
No, great question. We do have those classified in the prison system as mental health level 3. We have at least 6 providers that have severe persistent mental illness where they need strict oversight. So we have 6 providers that closely monitor those individuals. And also we have what's called THOR providers, they're certified drug and alcohol centers, many of you know those. We have at least 6 or 7 of those that are RPH providers that provide that drug and alcohol treatment if they need that component. But we have some agencies that do provide sort of an in-house treatment or counseling or job services that are real. It's a unique program because you have community service boards, you know, on one end, and then you have sort of a mom and pop, real passionate agencies that formerly incarcerated people running them. that are doing some of those services. But I agree, part of the missing piece down the road is having the wraparound services for everyone. I don't know if it's going out and applying for money through foundations to get it because of the cutbacks with the state, but there is a lot of opportunity to grow. But we are doing that, and also community supervision. Their supervising officers are supposed to help the individuals, get them connected to treatment. Did you want to say anything else, Mary?
Yeah, I was just going to say that we have, hi, I'm Mary Elliott, by the way. So I'm at reentry with DCS, so Department of Community Supervision. So I am the operations manager for the west side of the state. My counterpart had another meeting, he couldn't be here, that has the east side. But unfortunately, due to, budgeting and things like that, we only have 17 reentry sites, so 17 community coordinators basically, and they work to do just what you're talking about.
17 for how many?
That's 17 for the state. So they're in our highest population. They're strategically placed in those areas with the highest religious population.
Yeah.
So those that have the highest coming out. I will say that in those other circuits and counties, so that's 17 of our, I don't want to misquote it, but all the circuits that are within Georgia, those judicial circuits. So we had received previously funding to expand into 5, and then that was with the recent cuts, we lost those additional 5. So I will say that within those 17, though, we are out building resources all the time, be it mental health, housing, all type, connecting to resources, employment. Our top 3 areas that we're looking at this year that we're expanding in are employment, housing, and mental/physical health. So we're connecting and we're working on statewide partnerships. We're working on those local ones. With that, if someone has, and they're going to a circuit where we don't have a community coordinator, we work with those officers to make sure that we're identifying those resources and connecting people to it. So to do that. I did make a note to get with Tammy Perry, who's over our RPH, to see, I know that previously the reason for that was because there's a lot of questions that has to be answered by the RPH, as far that only the counselor would know. Now, I made a note to get with her because if there's a way to bridge that, because there's been turnover of counselors and all that, but I mean, if you're already working with someone and you know that, well, if it has to just come from a GDC address, then why can't you get with the counselor? Yeah, there's just ways going through my head to get past that gap.
That's right.
It shouldn't be that, that's the only way to access that. So she's kind of our resident expert on that, so I'm going to get with her to see how else we can work through that. I do know that, it's an amazing program. It's a way to get individuals into housing that otherwise would not have housing. With that, we've been working close with GDC and with other agencies with DVHCD to look at those individuals who are being kept in facilities past their TPM simply because they don't have somewhere to go. We helped move out 19 just within the last few weeks by working with those community coordinator resources. Especially those who are housing transition centers who already have jobs. And it's like, okay, if you already have a job, then let's just help find you housing. You did mention one thing that's a big barrier for all, and all I can say is work with your legislators, because the issue with sex offender housing is not because we can't get people willing to do it, it's because of the proximity restrictions. Right. They physically can't live in a whole lot of places.
And then you've got old law, you've got new law.
Right, and our officers, everyone, they're wanting to help find them housing. It's just, you have to follow the law there when you're trying to get someone into housing, and right now there's just a lot of restrictions with it.
All right, we do have,
Right, and that has been, part that we've worked with as far as, well, if it's better that you have someone where you know where they are, or that they're, that you don't, because they are. So.
But in 2018, RPH does expand the SO population,
Yes.
and there are at least 3 providers that handle that.
There's not a lot, but it's better than none. We had none for a while.
So I think there are, one of them takes females. But there's a couple in Atlanta. I don't know them off the top of my head, but if you want to get with me after.
Okay.
So, but thank you so much, Mary.
Yeah,
Those community coordinators do. Yeah, they do a great job. They really do. Well, thank you again. Thank you for what each of you do, and we appreciate you. Thank you so much.
Oh, this is exactly what I wanted to see happen. Get everybody out their offices and come in here and talk to each other. It's fabulous. Brandon wanted to do a quick
update on one of the bills that Ira talked about, and then Marissa is gonna come up and do a quick, on speaking to legislators for those who are interested, and I hope that's all of us at some point in time in our lives, that we're talking to the folks who are representing our interests in our local communities, but they also weigh in on the rest of the state, so we all should be talking to our representatives. So go ahead, Brendan, from National Incarceration Association.
Hey everybody, I'm Brendan Spar, and I'm the policy analyst for the National Incarceration Association. Ira this morning spoke about the opposition to House Bill 720 that Southern Center's opposing. The NIA is opposing House Bill 720 as well. It would introduce a mandatory lifetime probation for sexual offenses upon the second offense. So once an offender commits a second offense, the judge has no other choice but to sentence them to a lifetime on probation. That made it out of rules this morning, so breaking news, that is out of rules. And if you have ever watched a Rules Committee hearing, most of it's yay, everybody, it just goes right through. This actually had to go to a hand vote. There was enough opposition that they had to count hands. It was the only bill this morning in rules that was that way. There is opposition. 3 of the Judicial Non-Civil Committee members voted nay on it. So there is a lot of opposition, or enough opposition to get the ball rolling. Today is the day that we need to go out and lobby our legislators against this bill, House Bill 720. DCS has already taxed enough. Commissioner Nail has already said that 3 years on probation is enough. Why do we need lifetime? And his officers are stretched so thin trying to provide these resources. And we've heard this morning how the resources are so scarce. You put someone on probation for life, and what chance do they have? So House Bill 720 is going to be voted on the floor of the House either today or Thursday, so we need to lobby hard and start talking to our representatives to vote no on House Bill 720.
Thank you.
Good morning. My name is Marissa Dotson. I am the Public Policy Director at the Southern Center for Human Rights. Delighted to have this discussion going on today. The more we are here and trying to figure out what kinds of partnerships and collaborations exist, the more effective we'll be. I was talking this morning about this series and bringing people, like-minded people together once a week. And I think we've not done a great job figuring out who our allies are and how we might coordinate. And I think that as we build capacity and momentum, these kinds of opportunities will be really important. But we can also spend a lot of time preaching to the choir in these spaces. And so one of the important parts of bringing folks to the Capitol is to figure out how we message on some of these things to people who have the ability to make a difference and move and change policy. And most of them, unfortunately, do not see the world the way we do. And so what I'd like to do for the next couple of minutes, for those of you who may not have done this before or are thinking about ways to engage your legislator, we have prepared a handout that's out front. You might have already grabbed it. It is the Criminal Justice Reform Lobby Tips, the do's and don'ts of lobbying here at the Capitol. I will tell you, like I said last week, and I continue to say, it's intimidating. I am a trained attorney. I have been down here for 12 years, and I still am anxious and intimidated to talk to legislators about some of these issues. So you can only do well if you're prepared. This is a hard thing to do. There are more than 400,000 people under correctional control in Georgia right now. We are here on behalf of the people whose lives have been impacted. It's hard work and it's important, and the more we do it, the better we'll get. So in terms of the do's, kind of thinking about what you might do when you're thinking about preparing for your time as legislator. The first thing is to prepare. Sometimes people are like, I know this issue. I've been impacted by this issue for all my life. I know what to say. We don't. When that moment when they come to the ropes, or when we say they come into the office, we're like, what exactly do I say now? So think about those things. What's the 1 or 2 points you want, issues that you want to talk about? Gather some thoughts now about what you think you might want to say if you had 1 to 2 minutes with a legislator. What points would you want to get across? So prepare, identify and prioritize the lawmakers you'd like to speak to. Out front, I believe we also have the directory of the committees that consider criminal justice reform. So look at that list. See if you can look online on the website, look at their pictures. You can figure out their hometowns and their districts. If there's some connection that you might have to them, how you might engage them in a conversation. plan to spend 2 minutes, 2 or 3 minutes is probably too much, because they're short in their time these days. So I say choose 1 or 2 issues. I would say at this point in the session, probably 1 issue, and think about like 1 to 3 talking points, and think about it in your head. I want to say, if we did a better job investing in healthcare in the community, we would save taxpayer dollars, improve community health, and maintain public safety. Whatever those things are that you want to make sure that you're hammering home in your message, think about that stuff now. Highlight your experience. I can't stress enough the importance of the leadership of people who are directly impacted by these issues. Both because they have been confined and had to deal with it as an accused, in the context of being a defendant or the accused, a family member who has experienced this issue on behalf of a loved one, a service provider that offers care and services to this population. Think about why someone might care about what you have to say, that you bring some expertise to this issue. Stay calm and polite, and that is hard sometimes. Despite the demeanor of the lawmaker, if you all haven't spent any time in any legislative hearings, I encourage you to do so. You would be shocked by some of the statements that lawmakers make, some of the ways in which they engage the people that we care most about, and it is heartbreaking and infuriating. And so know that is a possibility. Remember that we, again, are representing more than just ourselves. And so when we are engaging with the hostile lawmaker, if we are also hostile, what will that do for us in our movement? Be open to questions. Be interested in what they have to say. I was telling somebody, if they're asking you questions, that's a good thing. Because if they just listen to you talk and say, okay, anything else? That's actually not as helpful as if they have some questions. So be open to them. Watch their body language. I think sometimes people just kind of talk, and they're not noticing that the lawmaker is trying to get a word in or may have some concerns with something that they said. If a lawmaker reacts to what you said, stop and say, you seem to have an issue with that. You mind telling me what you're thinking or what that might be about? Try to have a conversation with the lawmaker instead of thinking about just talking at them. Ask them their position. Would you support House Bill 760 if it was on the House floor today? This is an opportunity to divert people into treatment instead of into incarceration. Would I have your support on that bill? If they say no, say why not? And then follow up with your talking points. Do you know it would save taxpayer dollars? Do you know it would improve public health? Do you know, that kind of thing. Thank them for the time, despite how hostile or mean they are to you. If they only give you 2 seconds, still say thank you. We, again, are representing more than ourselves. The don'ts. On the other side, we have some of the things we want to stay away from. Don't try to cover too much. And I struggle with this because I think, hey, I have your attention. I want you to know everything I know. Most of these people are not most. Every one of these legislators is a part-time legislator. They have other jobs. This is a 40-day session. They will never be criminal justice experts. They will never be healthcare experts. Do not expect that you will be able to impart all of your wisdom and experience on them. Narrow your talking points and your issues. Don't avoid lawmakers that you think won't be supportive of our reforms. You would be surprised by some of the bills that are both introduced, supported, and opposed by people that you would expect to do one thing or another. So I would encourage you to treat every lawmaker as if you could be persuasive and continue to treat them like you might have been persuasive even if they don't act like they are. Don't confront, threaten, or beg. I use this example a lot. I've heard it before. It makes me cringe. I'll just vote you out of office.
Yes, I have watched somebody.
It is true that your voice is powerful, that the way that we exercise our power over people who are elected is through the vote. Take a mental note. Don't tell them that. Just say, we really wish we could have more conversations with you. This is a really important issue, and it's unfortunate that I wasn't able to have more time with you today. That's it. Don't chase them. Don't beg them. Emotional responses are appropriate. If you're telling somebody about something that was hard for you and it actually evokes an emotional response, that's fine. I think that's appropriate. You shouldn't feel like you can't do that. But don't turn on the waterworks because you think that that's going to make a difference, because it probably won't. And again, they will see that as a ploy instead of as a genuine thing. So be mindful of that as we encourage you to, again, be sincere and not trying to hinder your ability to be your honest and sincere self. Don't be dishonest or make promises that you can't keep. Don't start selling the moon. You know, if we treated people with mental health, then we wouldn't have our criminal justice system. Don't make those kind. I mean, there's probably some truth to some of the idea about what treatment might do, but don't oversell. You know, don't make promises that we can't keep. Don't answer questions because you think you have to be an expert right there. If they ask you something that you don't know, say, I don't know. You know, that's a great question. Or I haven't talked to that stakeholder. Love to get back to you on that. Go find Tony or me or somebody and say, this lawmaker just asked me this question and I'm interested in getting back to them with an answer. Let us help you find the answer. That's a perfect way to go back to that lawmaker and say, you know, you asked me about the cost to local governments to divert people. Here's what I learned from the Atlanta Pre-Arrest Diversion Initiative about what they say their costs are. It's another way to have a follow-up contact. Then you can be seen as a resource. It makes us all of our work a little bit better, that they will take you as a credible resource. They won't think you're just somebody who sells them things that aren't true, and they may follow up with you for additional information. Don't be offended if they won't speak to you. It's a busy time of year, and they may not come out. I'll talk to you quickly about how you get them out, but if they come out or won't come out, think about how you might get them a note to them. You might send them an email later on or give a call to their office and say, I tried to see you today when I was at the Capitol. I'd love to be able to make some time for you. I'm interested in this bill, this issue, whatever it is. When you go over to the Capitol, we need to start having these sheets so I can use them as little props. But the call-out sheets. On the House side, you have the sheets are about this big, and you will fill out your name, representative's name, the time of day, your telephone number. So important if you're a constituent of one of these folks to tell them that. Usually people who are here from Atlanta have lawmakers that are generally supported, as evidenced by the local reforms that are already happening and are happening in coordination with state officials. Thank you. How fabulous. So usually people will ask me something like, well, what about if my lawmaker is already on board? I say, see your lawmaker because you're here. And you, again, don't assume that they feel a certain way about it. Check on them and tell them, what are you doing behind the scenes to get HB 760 or HB 702, whatever it is, whatever you're here about. Ask the legislator what they're doing about it and how you can help them even if they're supported. Take a look at those committees that we have there in terms of the directory, figure out who they are, and tell them in the message what you want to talk about. I'm here to talk to you about whatever that issue is. I'm here waiting on you. If the page comes out, the way that you do this is you'll fill out this form, you'll give it to a nice lady at the desk. She will give a page, a little wonderful elementary school student, a copy of this. They will go inside and try to give this to the lawmaker. That page will come out and say, they're there. They said they can't come out right now. They weren't at their desk. You know, they said they're coming. You want to make sure that you remember the page's number. They'll have page numbers on them because I have lost my page many a time. But just think about that number there and tell them where you'll be. If they come out and they say, couldn't find the lawmaker, or they said they wouldn't come out, think about what you might want to send in, because then you're thinking, I want to use this part of my sheet. And I want to tell them, okay, thank you, will you put this back on their desk for them? So when they come back, they have a nice note with a telephone number and email address of someone who came to talk to them. If you have a handout that you want them to have, say, will you go and put this on their desk? Find a way to follow up with them if you can. Same thing is true on the Senate side, although the sheets are a little bit bigger. They're about half a sheet or a little bit more. Our friend Jeff Willard says that because they think they're more important. But same thing is true on that side. If you're a constituent, let them know. If you have an issue, send that in. Have the same kind of process on the Senate side. If you have some time, I don't think that there are any criminal justice hearings today, but we are and will be sending out calls to action on some of these criminal justice bills, and there will be opportunities to come to hearings and hear, and even on bills that won't pass this year. For example, the HB 702 is a death penalty repeal bill. It has not been heard yet. Crossover day is Thursday, not likely to pass this session. But it is possible that at the end of the session they may hold a hearing on the death penalty in Georgia. This is our opportunity to have a robust discussion about all the problems with the death penalty. So we would want to let you know, on March 18th, this is the day where we're going to have this hearing. Come, testify in support of the bill, that kind of thing. So we will try to offer opportunities to stay engaged. Any questions about all of that?
Marissa talks fast,
This is a lot slower than I thought it. Any questions about any of that? All right, so let's start this out.
appreciate all of you. Well, help me thank Dr. Jackson for participating. Thank you for participating. And all of our partners, we really, again, look forward to continuing to connect with you all and thinking about other ways that we can engage the community. At the Capitol is often hard. We do want to try to get out into some of the local communities and other ways and think about ways to do that. So if you have suggestions, shoot us an email. I was very, so I forgot to tell y'all that I'm Tony, in case y'all figured out. I was wondering who Tony was. I was thinking, I said, I know, I wonder, like, who are they talking about? So that's my nickname, so that's me. So again, thank you. Again, if we have contact information, we'll follow up so that you'll have, because obviously I have a couple of cards, but I don't think I set anything out. And let's just keep this conversation going. And thank you so much for spending your morning with us and nasty out day. Anybody else? Any last minute words? Cutting out early?
Yes, thank you for your efforts.
All right, so we'll be in touch. Everyone be safe. Go across the street and close your lobby.